Hello everyone. Today we are going to talk about a paper on bone cement. This is a landmark paper published in Journal of Clinical Orthopedics and Trauma in 2013. This paper already has more than 500 citations and is very famous with undergrads and postgraduates, as this is a very important exam question. So, what is the use? Use of bone cement is that it acts as a bone filler and it integrates with the cancellous bone and helps in loading the transmission of weight, most commonly used in arthroplasty of hip and knee. It has basically two components. One is a liquid monomer and a polymer bead made of polymethyl methacrylate. When these two are mixed, it causes a exothermic reaction, generates heat, and it eventually sets. Apart from these two components, different other components in this bone cement is a radio opaque dye of barium sulfate and zirconium oxide. You can use either, and this helps in making the cement radio opaque on X-ray and helps us to identify aseptic loosening or septic loosening. Apart from that, there is an initiator called DPO, there is an accelerator called DMPT, and then there is a stabilizer in the form of hydroquinone. And there may also be addition of heat stable antibiotics like gentamicin. There are different stages of cementing. So first is a mixing stage where you mix the components and it causes an exothermic reaction. Second stage is a waiting stage where you can play around with the cement and it starts to just release some heat. Then there is a working stage where you put the cement on the implant or where on the bone where you want it to be, and the fourth stage is the setting stage. But this bone cement is not without complications. The main three complications which can happen with the use of bone cement is: number one is bone cement implantation syndrome, where the patient may land up in hypoxia, hypotension, and there could be release of microemboli. So it is very important while cementing to tell your anesthetist that you are going to do bone cementing. Another complication which could happen is loosening or necrosis of the bone due to heat release. So it is very important to put some saline if you expect a lot of heat to be generated. Then this paper also talks about generation of cementing. So there are basically four generations of cementing. The first generation of cementing was simple pre-hand mixing of the cement and put it in the canal. There was no pressurization and this had a lot of loosening, and the